Good afternoon, everybody. I'm Brooke Lovelace, the director of the Iowa Developmental Disabilities Council. Thanks for joining us for the third meeting that we've had in our Take Charge of Your Healthcare series. Today, we're going to be talking about going to the doctor. We have one more exciting session coming up next Wednesday. If you haven't registered for that, you still can, and that is called The Care You Need. You can, and I'm going to put this in the chat in a minute, find the past 2 recordings that we've done on our website along with some resources. And you'll find this recording today too there if you missed anything today. And then you can also register for next Wednesday if you hadn't with this link that you'll see here in a minute in the chat. We do have an interpreter here with us today that's hopefully spotlighted for you. With that, I think I'm going to go ahead and turn it over to Tammy to kick us off today. Again, welcome and thanks for coming.
Yes, ditto on Brooke's welcome and thank you for coming today. As Brooke said, this is the third in our series for Taking Charge of My Health. And the first 2 sessions were before Thanksgiving. They are recorded, as Brooke mentioned, and you can view them on the website in case you missed them. And there's still time to register for our last one, which is next week, as Brooke said. We have been presenting the Taking Charge of My Health training in-person sessions for the last year or so. And this is the first time we've been recording them on webinar. So these will be available for people to view later. And we are learning and having fun with this webinar deal. Let's see, I have a couple things. Keeping your microphones off is really helpful so everyone can hear the presenters throughout. And if something goes wrong with your video or your Zoom, you can put something in the chat and we'll try to figure that out for you. We'll try to help you. You can keep your cameras off if you want to, or you could turn them on if you want. That's also. And if you have people watching with you in a room, like if you have a group of people in conference room or something, I'd really like it if you'd put that in the chat and say like, I have, 3 people here with me or whatever, so we can kind of get an idea of who's attending. So with that, for the last several sessions, we've been using this slido.com to ask for audience participation. And so what you do is you take your phone camera and you take a picture of this code, and a Slido app comes up on your phone. And when we ask a question, it'll tell you to answer, and you'll answer on your phone. You can, if you don't have a phone, you can't get it working to do that, you can also send your answers into the chat, but we've had really good luck with this, and I think it's been going well. So download the Slido app, and a couple times we'll ask a question in the Slido. At the end of the training, we will have some time to ask questions and have comments. And during this session, we might be asking you to like unmute and have questions or comments during the session. When we get to that, we'll let you know. And as I said, the session is being recorded. So if you want to watch it again, we should have the DD Council will post that within the next couple days, and it'll be available on their website along with the other 2. Again, we're excited to be here. And now let me introduce the stars of the show. We have Edward Especk, and Dayreen Lovan is ill today, but we have her being replaced by Lori Schneider. So go ahead and introduce yourself, guys. Take it away.
I am Edward Especk. I am the self-advocate coordinator, and I'll pass it over to Lori.
And I'm Lori Scheidler. I'm the program coordinator. I'm also the mother of a teenager with autism and ADHD.
Okay. So today, the goal for today, we are going to talk about different types of checkup, different types of places to see the doctor, or different places to see the doctor, prevention care, and the way to find out what you need, and the level, understanding your body, and the way to get the help you need. And then we will give you guys some examples of that, and we want you guys to engage with us playing with as a little game. Why we get into that time. And then we talk about self-advocacy again, as we've been talking about, so.
Next slide. So we are going to talk about some different types of checkups. And before we get into that, we'd like to get your input on what are some different types of checkups that you have been to. You could put it in the Slido or in the chat.
I check, I doctor,
Doctor's a popular one. And dentist. Mammogram. I see physicals, annual physical.
I know physical that if you have big.
That's a popular one. Chiropractor. And I see therapist and psychiatrist in the chat. Good. Oh, a lot of good answers. Oh, thank you for your participation. So today we're going to talk about, there are many different types of checkups, as you could see from the feedback we received. We're going to focus on annual checkups, eye checkups, dental, and preventative services today. So starting with preventative services is care that you receive to stop illness and diseases before they start, such as diabetes or heart disease. And one of those type of preventative services is also your annual exam.
Yeah, like when they do the exam, they can maybe find something
Exactly.
that is wrong with you and they can support you.
And prevent it from happening or getting worse.
Yeah.
Because sometimes we have things wrong with us we don't even know or realize. So in the annual physical, it's a good to go one time a year. Even if you feel okay, like we were talking about, sometimes you don't even realize you have something going on. And so they're gonna check your heart, your eyes, ears, and other parts of your body. They'll also check your blood pressure, measure your height, and weigh you on the scale. And sometimes they'll even give you your immunization shots during that visit, such as like a flu shot or COVID shot, to prevent illness.
Yeah, especially when you have appointments, when we have appointments during flu season,
Yes,
then it's very important that you do that.
absolutely. And it'll help us from getting sick or as sick as we might get.
Yeah.
Prevent it from getting worse. So as you can see, one of the things we mentioned was diabetes, and to check for that, they do a blood test and they check your sugar levels, because diabetes is when your body is not regulating the sugar like it should be. So they can do a test to see if your levels are okay. And if they're slightly off, you might not know it, and they can help you with recommendations like diet or sometimes even medication.
Or even do more testing to find out.
Yeah, they might want to do more tests, absolutely. And then same goes with heart disease. They'll check for that, and they'll check it by checking your blood pressure or cholesterol. And they want to see if you're at risk for heart disease, stroke, heart failure. They'll also check your cholesterol by doing a test, and just to lower our overall risk for heart disease.
Now we are going to talk about eye checkup. Most of you have said have put that at the highest on your list. To do the eye checkup, you need to see the doctor 1 to 2 years at least. Sometimes you can go in for the eye checkup, but it's really important that they check that every time you go in for your physical checkup, so that they can see the difference between where you were last year to this year. And sometimes that help you to know that if I have a headache, that headache may be not from my type. So it may help me to figure out a way how I can think about how I can rest my eyes tight, or if I don't see where I may be having a problem. So I should be checking with the eye doctor for that. So it's quite a popularity in the on that slide though. So wanted to bring it up too.
So is it possible that I might get glasses if I go to the eye doctor for a checkup?
Depends on the situation. You have to sometimes they recommend you to they may recommend you to take some medication. Or sometimes they may give you medication that you put in your eye. And sometimes they may recommend you to choose another provider who is taking care of the eyes because they're two different professions. So. Now we are going to talk about dental and again the dentistry came I think the third place. We want to talk about that. Here where they will clean your teeth, this text, and they will clean your gum, and they may take an X-ray to see whether you have either symptoms. For example, in my case, I went to the dental for my regular cleaning up. But they prevented more for my teeth, and they cleaned my teeth very well. But then they found out that I may have a tooth was having
Cavity.
a cavity, so they end up looking at that, and they set up another appointment for me. So that helped me to know that oh my God, I needed to see the provider right away because then they took care of that. So it's another way for preventing something from happening.
So was your tooth hurting at the time? I mean, did you know something was wrong?
No, it wasn't hurting or anything. It was just
So they were able to,
opened up to see.
they found it before it started hurting, which was good.
Yeah, they prevented it from being painful.
That's a good thing. So, like we were talking about, sometimes a doctor might recommend things from the test. They might see something that's wrong, or in a case going to the dentist, they recommended fixing the cavity. So that leads us into choices with our doctor. And they might have recommendations that include medication or treatment or special diets. And so that before we get into the choices of the doctor, we want to bring up self-advocacy that we've talked about before, that you have a choice you have a choice. And even though the doctor recommends it for you, you can ask questions and you can make that decision. So we'll go to the next slide and talk about self-advocacy. So you know your body best, and you're your own self-advocate. And I think Ed has a story that didn't you have to make a choice with your doctor where the doctor recommended something and you thought differently because you knew your body best.
Yeah, so before I got past playing football 1 year, and then I went to my doctor, but they told me to drink water and I'll be better. But I wasn't feeling better at that time. So it got worse and worse. So I remember talking to my coworker, and they told me that the doctor told me that I wasn't that there is something more after they tested me. After that, I went and I talked to my colleague who helped me get into that place where I needed to see the regular doctor, and they recommended to see more professional, and the way they found out that I have a bigger problem with my body that needed to be taken care of very seriously. So that was the time where I stepped up and I advocated for myself, to people that I'm not okay.
Yeah, you felt something different and you knew it was more serious.
Yeah, and it became more clear
And thank goodness you
from
did.
that point. So
And you have that right. And you have that right to ask those questions and say, hey, I'm still not feeling good. And you have a right to even ask for a second opinion, which it sounds like you did.
yeah, we did that because we felt like we needed more help from other doctors. So we asked my primary doctor if we can see these other providers.
Yeah.
To take care of us, and they were both recommend us going to different areas of the doctor. So
And I think I heard you say something about talking to someone else about it. Was it a friend or a colleague?
yeah, if I recall it.
So sometimes we have a team of people that will help us advocate and, you know, especially if we're not sure what to do, we can ask questions of our friends, family members, a social worker, or even another doctor, to help support us in that. And some people might not want that.
So we have a question here for you guys. Who can support you? Who is on your team that can support you?
You could put it in the chat or raise your hand.
Who is on your team that can support you guys?
I see my husband.
Yeah.
Any other ideas of people who can support us in our healthcare and
I do.
good friends?
My good friend, sister, someone was shouting us now.
Good. So it's good to think about who those people are in our lives. Oh, do we have anything?
Dakota.
Oh, Dakota.
My nurse.
Good. Dakota says his nurse is there to help support him.
Yeah. And it cannot be your staff person.
So going on, thank you for your participation. I see caretaker as well as family, parents, and guardians too. So these are all people that can support us in advocating and in making decisions and choices in our healthcare.
And that is what the next thing we are gonna talk about, making choices and be advocates for ourselves. So, and can I have someone read this with the audience? Did the council or other group?
What is your question, Ed?
Can I have someone read this?
Oh, read the slide. Well, I can do it since I'm off mute right now. Okay, so this says making choices with your doctor and talks about based on results of the tests or something the doctor finds, he might have ideas about what you should do. And we want to say you can make your choices about that after you ask questions and get the information.
So we've been talking about, go ahead.
Thank you, Tammy.
So we've been talking about know your body the best. And this situation is coming in a lot. And my example of my story again was through that decision I had to make with my provider. After they explained everything to me, and my team, they were able to, are able to get the decision made. And the decision that I made was for me to look forward, I had to make a bigger decision. And that decision was to have a next children, and I did. Now I feel much better and much comfortable.
That's good. But a lot of things happened before you made that decision to get surgery. Wasn't there like another specialist that they recommended you talk to, or you asked for a different?
Yeah,
specialist?
so there was so we went to the orthopedic doctor,
Mhm.
and they recommended me to, because they were not seeing as a provider. So I recommended to see another provider because it is my body and I want to know what they can do with me. So they recommended me seeing another provider.
Mhm.
And then I decided to go there, and I love the provider because she's the one who encouraged me to actually get a surgery. And so I feel I'm good now. I feel better now that I'm able to do that. So because of that experiences that I am an advocate, I was able to advocate for myself and for my dad to know that I want to do this. So I told my dad that, hey, I need these children more than after I listened to everyone,
Mhm.
I needed to make that choice, and I did.
And you were able to make that choice informed because you were able to get more information from different specialists.
Yeah.
So the important thing is just remember, like I was saying, that it's your body and you have a right to ask those questions and make that decision. So going forward, we're gonna talk about, we talked about going to different doctors. There are different types of medical offices that are out there. And we're gonna talk about three main ones about where we can go for care. Because sometimes we're not quite sure of which office to go to. So the three offices, oh, we're gonna first go to a Slido, I apologize. We would like to get your input on what are the different types of doctor offices that you have gone to? We see quick care,
Who care is a big one.
that is an emergency room,
I check out.
and dentist. Emergency room getting big, that's a popular answer.
That is not a popular one.
Private practice. I see primary care doctor, OB/GYN, regular doctor. So a lot of good answers out there. So as you can see, there are many different types of doctor offices. For today's purposes, we're going to focus on three different ones that are basically your starting point to these doctors or different offices of treatment. And the first one is your doctor's office, which is your primary care doctor. And this is somewhere that we go to for a physical, where they do the regular screenings like we talked about earlier, like the blood pressure and cholesterol. You might get immunizations here. And they know the most about you. They've got your history. And if we go to other doctors, we often have information sent to our main doctor.
And here they may give you also the information you need to know
Mhm.
about your body because they know who you are in
Yes.
the situation. So they may recommend you to either doctor too.
Yeah, it was kind of like when you went and got a second opinion, you went to your primary care doctor because you knew that that doctor knew you best, and they can look through your history, and there's more of a
Yeah.
trusting relationship there. So another option we have though, because sometimes we're in a situation where our primary care doctor might be backed up and we can't get in for several weeks and we need help right away,
And
like the same
here,
day.
and here we will go into the walking in the clinic. And this is the first way to get your appointment. Also, there may be offices like Lori was saying, there may be other offices, but this is where you get your doctors to come and get you where you need to be. Like give you time to talk for yourself, and they may have time to listen to you, your content. That's the good care too.
And we don't have to wait several weeks to get in, because sometimes when you're in a rural area, especially, the doctors are backed up. And you might have something going on that you want addressed that same day or within the next 48 hours. And the walk-in clinics, they have availability quicker.
They do, they always do, because that is the good thing about them.
It is. And then the next one we're gonna talk about is the urgent care, which is much like a walk-in clinic. The main difference with the urgent care is that they have more equipment there. So they can address more serious things, like if you have a bad cut, they can give you stitches, or they have x-rays available.
If you have a broken or a broken leg or something, then they will take care of that.
Yeah, they can figure it out because they have the x-rays there. And if it's something more serious and they feel like it needs to be attended, like by the emergency room, that they'll send you there, but they would have that expertise to know and the information. Speaking of emergency rooms,
Can I have another person with this? Or with the audience?
I can.
thanks, Dakota.
Yep. The emergency room is for life-threatening things, such as uncontrolled bleeding, head injuries, chest pain or difficulty breathing, seizures, compound fractures, the bone is sticking out, mental health crisis. Someone should take you right away or call 911 for an ambulance.
My example was the same thing. I went for the neck pain, and this because I had a concussion the day before, so I went in for that for that for that pain, and then they checked a lot of stuff, and they didn't see anything, so they sent me home. That they asked me couple questions like, "Did you know where you are?" I was like, "Yes, I do know where I am." But then they sent me home after that, so it wasn't like it was like a quick emergency care, but instead they didn't. It wasn't so serious, so they sent me home instead. And then when I went to my other provider, it's where I found out that this something is serious.
Something's going on.
I shouldn't have taken care of it right away from that emergency room. So that is another example. And someone call 911, they may send you the ambulance, or they may send you even the cop to check on you, to see whether they can call the ambulance, or whether they can call someone else to assist you in the situation. So that's another.
Yeah, and it's kind of like what we talked about earlier, you know your body best. So if you feel like there's something life-threatening going on, this is the place to go. And like I was saying, if you can't get there, you call 911 and they'll send somebody to assist you.
Or if you can't call 911, have someone call 911 for you.
Mhm.
Or tell your staff that I have this crisis, I don't know what is going on, so that they can call 911. And if you are non-verbal communication, that is even more important, that people cannot understand you very well. It is important that you call someone else who can understand to maybe call 911 for you in that situation.
So now that we've gone through all the different places that you can get that initial care, we're going to talk about the levels of symptoms and what symptoms are.
And so we wanted you guys to put this in this chat. And we also wanted you guys to feel like we are, once you guys to engage with us after this slide is done.
So what are some symptoms that would require medical attention? I see chest pain, seizure, severe dizziness. All good answers. Headaches, nausea, extreme vertigo, chest pain. So those are all really good examples of diarrhea, of things that could be going on with our bodies that we would need to see a doctor for. So that brings us to talking about what are symptoms. So symptoms are signs that we are sick and our body's telling us, hey, I've got something going on here and it needs some attention. There are symptoms that we can see and there are other symptoms that we can just feel. So the ones that we can see would be bleeding, a broken bone, a rash, throwing up, or changes in pooping and peeing. And then there's other ones that we could feel, but we might not be able to see, like Ed's toothache. Well, I guess it wasn't really hurting yet, but
Yeah.
you couldn't see it. And if you hadn't gotten it attended, you would have ended up with a toothache, headache, stomach pain, high temperature, feelings such as feeling really sad or confused.
Yeah, especially when you are in that situation where you are sad, you're always feeling like confused or you don't know what's going on.
Yeah.
And that's something that happens. I mean, in all of this stuff, I was confused. I wasn't sleeping well.
Mhm.
I was nervous too. A lot of time, so I went and that, and again that happened a lot with
So you reached out.
I happened to me too in those situations. I also had a headache, a lot of headache.
Which was your body telling you again, hey, pay attention over here.
It's time to take care of the body.
Exactly. Exactly. So when we have these symptoms, where should we go? We have these three main options. We talked about a non-emergency, which would be your primary care doctor that you would go to this week or when they have an appointment available. We talked about urgent care and walk-in clinics where you can get in, walk-in for an appointment. And then we also talked about the life-threatening situations or emergencies that you need to get help right away or call 911. So Ed's going to go through talking about and ask for your input on a game that we like to engage in.
So we want you guys to shout out, just this out loud or put it in the chat. Where should we go? Should we go in terms of this? If I have a rush or a nail, should I go to the where should I go? Should I go to the emergency room? Should I go to the call 911? Should I go to the annual checkup? Or should I go to the quick care? Where should I go? What's my primary doctor?
And you can put it in the chat or you could raise your hand.
What is in the chat?
Walk-in or urgent care?
So we see walk-in or urgent care.
Yeah,
And there's a Life Iowa phone number somebody provided. Thank you, Brady, that you can call and speak with a therapist. So that might be more like if you're not sure of what to do or
yeah, and this is really good and very important. Walking in the clinic.
so on the next slide.
We are gonna give you the answer we think is exactly walking in the clinic. And the reason why she's walking in the clinic is something not poisoning or it can be poisoning, but something not so serious. Where you should go to the emergency room, but even if you can go to your doctor and they can check on you.
Yeah, so the walk-in clinic, if it's really bothering you and very irritating, they could see you that same day and maybe you might have medicine that they can give you or
Or they may recommend as an idea or as a or give you more time to study what is going on, but they may give medication.
next.
Can I get another person to read this from the audience? If you have a chest pain, what should you do? Should you go to the primary to the doctor's office today this week? Should you see the quick care today? Or should you call 911? Or
Alicia unmuted. Oh, Alicia, you just muted yourself back.
what should you do, Teresa?
I think she's trying to unmute.
We can hear you now, Alicia.
Okay.
If you're having chest pain, which one do you think we should go to?
Listen, Harper, when you get up, a pile of dirty clothes, snacks I didn't finish, bathroom floor hair, and banana peels were smothered.
Alicia, do you know?
Call 911.
Absolutely. Yes, if
You got that right, and it's very important to call 911 because you are in a pain that you cannot control. So that is right, and that's a good point.
because it could be life-threatening.
Yeah, it can be a frightening life for you. So you need to take care of your body, and you know your body the best. So when you have a check problem, it's important to take care of it right away than wait for a week or a day.
Absolutely. Okay, so the next scenario we have, and the last scenario we have is if you are having some mild headaches lately, you're having some mild headaches and should you go to the primary doctor this week? Or urgent care today, or would you call 911? And you can put it in the chat. Oh, Brady, you have your hand up?
Yeah, and I thought maybe this would be helpful with what we're talking about, but I have been employed with the city of Waverly at the golf course, and I decided to go get recertified in CPR, first aid, AED, and I learned during those classes that if you come upon an emergency situation, a heart attack, and you're not for sure, like if somebody's having a seizure, somebody's having a heart attack, you don't have to 100% know what exactly is going on. If you walk up to a situation and you don't know what to do, it's not a bad thing to just go ahead and get on your phone and dial 911 and get them there. You know,
Point.
yeah.
And that is
And
very
a lot of
true.
people, I know in my town at the Waverly Health Center at the hospital here, a lot of people like, well, I don't want to call an ambulance because then I get billed. Well, our ambulance department with our hospital will not bill you unless they transport you from the scene to a hospital. So if they just come to the scene and check you out and you don't get transported, they don't charge you. So make sure that if you need an ambulance, you ask about that because some hospitals might accommodate with no charge unless they transport you.
Well, that's really good information, Brady. I didn't realize that. And you're absolutely right. Like if you're in doubt, absolutely call 911 to get somebody help. If it's yourself or somebody else where you think something serious is going on, absolutely. And like many of these scenarios, there are different options available. And we'll repeat again, is your body the best. And if you're questioning, that you just know something's not right, you know that because you're the one feeling it or having the symptoms.
And then, when you mentioned this before, sometimes you are unsure of what to do. It's also important to reach out to your family and ask for help from them. But sometimes they can recommend you to the other. So they recommend you to other provider. And of course, when that situation is very important. But if you are living with your parent and the guardian, and you are non-verbal, then tell them that the way you are feeling.
Yeah.
Point at what you are feeling, because that's the way some of us communicate. So it is very important that if you are non-verbal, you take knowledge to communicate with people so that they can help you in the situation.
That's a really good point. Very good point. So like in this case, we'll quickly go over, if you're having those mild headaches, oftentimes the primary care doctor would be the one to go to. But if you feel the headache is getting worse or more severe, there are the other options that go into urgent care or even the emergency room if you feel that it's severe enough. And that brings us to, what if you don't know where to go? And I mean, what should people do? If you don't know what to do, you're not sure which option to take. Sometimes it's really hard to know what to do. And that's where I was talking about that you can talk to somebody like a family member, a support person. You might even call your primary care doctor or a nurse support line, and they can help ask you questions and walk through like some options that you would have or what they would recommend.
Or get you some other areas of support that they can provide.
Mhm. Yeah. So what did we learn today? So we learned that we can take charge of our own health care. And we can do that by know the different types of checkups, understand the preventative care and how that keeps us healthy, and different types of places to go for care.
And kind of stickling, different type of stickling, and we always go for help. Remember, you know your body the best, and you need to know your body the best. You are the self advocate you can be the best self advocate you can be. In those situations.
Wow, what a good
Mhm.
conversation. Go ahead, Ed.
I'm gonna say any question no comment. No, you probably.
It's okay.
I would just like to make a comment about the dentistry. Um, we know at the Iowa DD Council knows that there is some issues regarding coverage for dentistry. We do have that on our register, and we are trying to work on getting coverage for dentistry.
Thank you, Dakota. That's really good. Good to know. I know there's been some availability of dentists, like just the number of dentists being available in the state has been a concern. So good point. Thank you.
Yeah, that's no problem.
And I see Brady has his hand raised again. Brady, thank you. You've had a lot of good input here in the chat.
Yeah. Hold on one second. I just wanted to share, since we're talking about dental and trying to find providers for dental, I, eh, and I think this would be a good time to share it, but I was on MCNA dental, and when I moved from Glenwood to Waverly, I could not find a provider that would take MCNA dental. And I struggled for months trying to find a provider. Well, I happened to be able to talk to somebody, and they said, "Have you ever decided to switch over to Delta Dental?" I have found out that Delta Dental, you know, for more providers take Delta than they do MCNA. So I was able to switch to Delta and find a fortunately I couldn't find a provider in my local community, but I did find one in Cedar Falls, which is like a 10 to 15-minute drive. So, but we talk about how to get services and stuff like that, and just something I want everybody to think about. If you don't qualify for something, do your research, because there could be a way where you could switch insurance providers to where you are covered.
Yeah, good point, Brady. And that's true, not just for dentists, I think for probably some other kinds of care too. I want to just highlight a couple things you said in the chat yourself. You gave a couple phone numbers for a Mercy patient nurse, and also for Your Life Iowa for I think mental health or those kinds of concerns. So those are some really good things in the chat, you guys, if you wanted to take note of those.
The other thing where you advocated for yourself. You knew what was going on, and you showed that advocacy that it's going beyond healthcare. It showed you that you are an advocate not only for yourself but for the provider who are in the situation, but educating all of us here.
Yeah.
Very
Thank you, Ed.
So does anybody else have some comments or want to share something they learned today in our session? Okay. Well, again, reminding you that we have the last in this series coming up next Wednesday at noon again, and it's going to be called The Care You Need. And Edward and maybe Dayreen will be back. I'm not sure, but we'll be talking about the care you need. And let's see, next slide. This is the contact information for our presenters today with their email address on there. You'll get the PowerPoint sent out to you later with the recording. But we wanted you to do another QR code. This is the thing with your phone again. And this is our survey about the session and what you learned. So you can click on that and take that. And last, just a reminder and acknowledgement that this series is based on the curriculum that was created out of Oregon's University Center of Excellence. And this material was created at the UCED in collaboration with DD Council. Thank you, DD Council. And it'll be available on the website. And also, we've said this a couple times, that this information is, general, and it's not medical advice. There is often not a right answer in any of these things, and you should deal with your individual situation as you understand it. And as Ed says, you know your body best. Thank you. Goodbye, everyone.
Have a good day, guys.
Hope to see you next week, everyone. Bye-bye.
Next week.